my favorite thing about working in healthcare is the people. This industry brings together brilliant, highly motivated individuals who are driven by the opportunity to make a difference. My name is Hallie Tecco, and this is The Heart of Healthcare, a podcast where I'll be introducing you to the people on the ground moving the needle in public health and medicine.
It's an unnerving scene. The body of a teen spasming in a coughing fit on a ventilator just to breathe.
It just progressively got worse extremely fast.
17-year-old Tristan Zofield was taken to Cook Children's Hospital in Fort Worth, Texas, with blockage in his lungs.
I woke up just throwing up everywhere, and my heart was just pounding out of my chest, going 100 miles an hour.
And doctors believe it was all because of vaping.
He's a very sick, otherwise healthy-looking child. And we don't see previously healthy 17-year-olds that sick that quickly.
E-cigarettes, or vape pens, were initially introduced to the world as smoking cessation aids. They claimed that it was just water vapor, surely less harmful than smoking cigarettes. But here's where things went wrong. The aerosol that users breathe from the device and exhale can actually contain many harmful substances, including nicotine, ultrafine particles that can be inhaled deep into the lungs, cancer-causing chemicals, and heavy metals, such as lead. Juul, a popular brand of e-cigarettes, has the tagline, "The Smoking Alternative." Sure, it's not a cigarette, but it still contains high levels of nicotine. According to the manufacturer, a single Juul pod contains as much nicotine as a pack of 20 cigarettes. With the advent of tasty artificial flavors, something that is illegal for cigarette manufacturers to do, vaping has become extremely attractive to young people. In fact, 1 in 5 high school students admit to vaping. A National Academy of Medicine report found some evidence that e-cigarette use increases the frequency and amount of cigarette smoking in the future. So it seems that the quote-unquote smoking alternative may really be the smoking gateway. Today, I'm talking to Dr. Susan Walley, who serves as chief of the Division of Hospital Medicine at Children's National Hospital. She is an expert in the prevention of youth tobacco use and tobacco-related diseases. She also serves as the chair of the American Academy of Pediatrics section on nicotine and tobacco prevention and treatment. Her research interests include developing effective healthcare and school-based interventions to decrease youth tobacco use. Dr. Walley, welcome to the show.
Thank you, Hallie. I'm so glad to be here.
All right, so to frame the conversation we're about to have, I want to make sure that I'm using the right terminology. E-cigarettes, vapes, vape pens, they're all synonymous?
You know, I think that really is a great question because oftentimes it is very confusing that there are so many names for the same products. But you're absolutely right. E-cigarettes, electronic cigarettes. There's also a term that you might find, electronic nicotine delivery systems. But for youth, they're generally calling these same products either by their trade name, like Juul or Puff Bar, or oftentimes vape, as you said.
Okay. And can you just give us a background on what these products are?
Yeah, absolutely. So these are products that were introduced in the United States around the mid-2000s. And what they are is they're handheld devices that are battery powered that are designed to deliver generally nicotine, flavors, and oftentimes like vegetable glycerin or propylene glycol to users. The part that is really concerning to us as pediatricians is that these are not safe products and they almost always contain nicotine, which we know is an addictive product. So these are tobacco products, and oftentimes you'll see mislabeling or incorrect or false labeling on these products.
I've heard them referred to as, this is just water vapor. That's not right.
That's exactly right. That it is not right.
Yeah, it's right that it's not right.
That's right. That's right. These products have, because they're tobacco products, we have found, or scientists have found, that they contain some of the same carcinogens that you'll find in, regular or conventional cigarettes. They also contain, high levels of nicotine. They contain flavors, which oftentimes can be dangerous, by their own account, as well as propylene glycol and vegetable glycerin. So they absolutely are not safe for youth to use.
Are these ingredients listed on the product?
So, great question. Oftentimes, the manufacturers will list nicotine, the propylene glycol or vegetable glycerin, and flavors. However, in this period of very limited regulation by the FDA, we have no assurances that what's listed in the product is actually what is in the product. So scientists have found other products like carcinogens, which mean cancer-causing agents, and other toxicants in these products that are not listed on the label.
So we can't talk about vaping without talking about the history of Juul. And most listeners, I assume, would know the history of Juul inadvertently marketing to children, using flavors as a way to attract children to the product. Can you give us, from your point of view, as a pediatrician, as an advocate, what happened? Where did this all go wrong? Because we had seen smoking rates decline precipitously over the past couple decades, and then the last 15 years go the other direction.
Yeah, I think you've hit the nail on the head that there was progress with, public health measures, and Juul came on the market in the mid 2010s. And due to, limited regulation, limited marketing, advertising, basically used the same playbook as big tobacco. So, if you look at the way that they were advertising, it was young, sexy models, very, very youth appealing. Yeah. And the same thing goes to what the flavors that they were advertising. So things like mango, things like, cool cucumber, creme brulee. And the reason flavors were removed from conventional cigarettes in 2009, with the exception of menthol, is because we knew that flavors attract youth. So unfortunately, Juul and other companies were allowed to use that same playbook to attract this whole new generation of youth to using tobacco products.
Yeah, but they didn't get away with it.
Well, the story is still emerging, and fortunately, the FDA did take some action by regulating that Juul and other pod-based companies needed to take flavors off the market. So Juul is still on the market with their tobacco flavors as well as menthol. Unfortunately, there was a huge loophole. And so both e-cigarette solutions, like what you might see in vape pens or what we call mods or tanks, where you pour the e-cigarette solution into the e-cigarette, are still a Wild West. You can buy any flavor.
So it's become a DIY situation.
Exactly. And what really is most concerning in youth, because this is the most common e-cigarette that they're using, are what we call disposables. Those are like Puff Bar, and you can buy them in any flavor. I went actually to a vape shop. I do this, sort of intermittently. I'll go visit a vape shop just to see what's on the market. Yeah. And I was actually told by the clerk, oh, well, these disposables are actually illegal, but, they're selling them. And they had death by chocolate, they had strawberry, they had sour mango, they had lots of different flavors that, aren't going to appeal to, a 60-year-old adult that might be quitting smoking. They're appealing to those teenagers and young adults.
Yeah. Wow. So you don't go in your white coat. You go undercover? I
do go a little undercover.
I'm surprised they don't have your face in the back room, in the break room. Look out for this doctor.
Well, I do purchase not, of course, I have a problem with, supporting tobacco companies, but I think
Yeah.
it is important when I talk with parents and I talk with other pediatricians to show them these products, how youth appealing they are. When you even just smell them, they smell delicious. You can understand why kids and young adults would want to use them.
Yeah, their brain lights up.
Exactly. That's those dopamine and serotonin receptors.
So Juul's tagline is the smoking alternative, and e-cigarettes were created, from my understanding, to help with smoking cessation. Is that also happening? Is it that we're helping a different generation quit smoking, but the cost of that is we're creating a whole new generation of smokers on the other end?
Yeah, one of my passions is to help adult smokers quit. I'm a certified tobacco treatment specialist, and in my role as a pediatrician, I see so many kids who have illnesses that are either caused or worsened because they have family members who smoke. And these family members obviously love their kids so much, but nicotine addiction is one of the hardest addictions to resolve. It's a medical disease. We know that now, that, being addicted to nicotine is probably one of the hardest things to quit.
Yeah.
And so no one wants to help smokers quit more than I do. The problem is that is not what we've seen with e-cigarette use. That the studies have shown that people who are not in a medical program, who use e-cigarettes, who pick up e-cigarettes to quit smoking, actually end up being what we call dual users. They use e-cigarettes when they can't smoke cigarettes, and they also are still smoking cigarettes.
Wow.
So that's really, really concerning to us, both in just thinking about as a society, particularly with COVID, and knowing the data that we know about, using cigarettes and having COVID. It's no surprise to anybody that outcomes are worse for smokers.
That's really disappointing to hear.
Absolutely.
So I imagine that a lot of vaping has been social peer pressure for young kids in high school and whatnot. Did we see a decrease in the uptake during the pandemic when a lot of the students were remote, or was it the opposite, that students were stressed and looking for some outlet?
Hallie, I wish we knew. I think, unfortunately, some of the data that we have does suggest that it has been a decrease with the pandemic. And what I'm referring to is a National Youth Tobacco Survey, which has yearly surveys. The problem with it is that the National Youth Tobacco Survey was an in-school survey until last year when it went virtual. And we did see numbers of high school students and middle school students using e-cigarettes go down, but it was a completely different way of surveying. And so the CDC, the Centers for Disease Control and Prevention, which gives this survey, says we really can't compare.
Sure.
But no matter what the number is, higher or lower, we're still seeing numbers of, 11% of high school students are current users, and 3% of middle school students are current users.
Wow.
And within that data, probably one of the most concerning things is that we're seeing those students who say, hey, I use, they are using a lot. So about, half of them, 44% of the high school students use e-cigarettes 20 or more days.
Wow.
So that just shows the level of their addiction.
Yeah.
I did also want to mention another survey called Monitoring the Future. That is done a little bit of a different way, but their data says that 24%, so 1 out of 4 12th graders in 2021 are using e-cigarettes, and about 10%, 8.9% of 8th graders are using e-cigarettes. So kind of depending on the study that you're looking at, between 10% and 24% of our high school students are addicted, potentially to nicotine. That's huge when you think about them growing up to be adults who are addicted. We know that e-cigarette use is a gateway to using regular cigarettes. We also have information and data that suggests that that is then the next step to drugs like marijuana, to other drugs of abuse. And as a society, that really, really worries us.
Yeah. Now, how does that prevalence among youth today compare to, say, the boomer generation, which is, as far as I know, has the highest prevalence of smoking? Correct me if I'm wrong.
No. I mean, I think that's a great point to kind of think, how does that compare? So in the United States, the most recent adult data, 18 years and older, is that 14% of adults smoke cigarettes. Now, that is way down, as you suggested at the beginning, of 40% of adults smoke. In that context, though, there are 500,000 people, adults, who are dying, adults and kids actually, who are dying from the consequences of tobacco use and tobacco smoke exposure. So, in 20 years, we don't want that number to be higher than 500,000 people dying. It's got to be lower, in terms of what we're seeing with the COVID pandemic, what we're seeing with healthcare, what we're seeing with healthcare inequities. We know that tobacco companies have intentionally gone after basically the Black community and targeted menthol cigarettes to them. And menthol is actually an anesthetic, so it basically numbs. And so the theory is that the Black community, African Americans, when they smoke cigarettes, 90% of them smoke menthol because that was what has been targeted in the Black communities. And they actually take deeper drags because, they're using a product that basically is numbing the airway. And they have more tobacco-related death and disease.
Wow.
So just the horrible nature of what we know about health disparities is worsened when we think about, tobacco and who's being targeted and who's using.
Sure. What are some of the other risk factors for using?
Well, definitely, with products like Juul and other e-cigarettes that are marketing and advertising their flavors and, kind of this lifestyle, our youth are basically being targeted. And, when we talk about the numbers of youth that are using, anywhere between 1 in 10 to 1 in 4 high school students, that is just a huge number.
Yeah.
I have 3 children, 3 boys that are in their teenage years, and they tell me, and we hear anecdotes of this all over the country, they don't want to go to the bathroom because they know there's somebody in the bathroom that's juuling or vaping, and they don't want to be exposed to that, the vaping, secondhand vape. And they also don't want to be in a situation where a teacher could come by and think they were doing it. Yeah. So this is really affecting our kids in so many ways.
So how does the price of the Juul or the Puff Bar compare to cigarettes?
Great question. And it really depends on what state you live in and what the state tax is.
Okay.
So in a state like New York that has one of the highest tobacco taxes on cigarettes, it actually is less expensive for a youth, in terms of thinking about the amount of nicotine to purchase something like a disposable e-cigarette, like a Puff Bar. I went to the local vape shop recently and, for $10, I was able to purchase an e-cigarette that had a very high level of nicotine, about 50 milligrams per milliliter of nicotine. And just, for comparison, if somebody is to smoke a cigarette, then that's about 1 to 2 milligrams of nicotine that they would absorb.
Wow.
So some of these disposable e-cigarettes have 5 milliliters of liquid, of that e-cigarette liquid. And at 50 milligrams per milliliter, that's 250 milligrams. That's a massive amount of nicotine. And that's why we feel like our youth are getting addicted so quickly.
And are they not taxed the same way cigarettes are taxed then?
No, unfortunately, there's no federal taxes. There have been some state and local movement to tax and use that revenue, hopefully, for research on how can we get these kids in an evidence-based way to be able to quit, to be able to get over this medical disease, which is nicotine addiction.
Yeah. Is that something that you're advocating for?
Absolutely.
Yeah.
And multiple medical associations are advocating for that.
We'll be right back after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
So how important were the flavors in the initial uptake of e-cigarettes amongst teens and young adults?
It was very important. When we survey teenagers and young adults to ask them why are they using these products, generally the top two reasons is either curiosity, and I think probably peer pressure plays into that, and flavors. And we know that some of the flavors are come in very child appealing, gummy bear, Sour Patch Kids, Death by Chocolate. And, there are over 7,000 flavors, and most of them are ones that would appeal to children.
Wow. What's the impact of the addiction to these devices for children and how that differs from an adult picking it up?
Absolutely. We know that the adolescent brain doesn't fully mature until 25 years of age. Anybody who has a teenager knows this. And so when we think about the impact of, nicotine use, especially very frequent nicotine use, we know that it causes long-term, both short-term and long-term impacts on brain chemistry. Not only that, we know that there can be behavioral changes. We know that, it's a gateway potentially for other, drugs, including conventional cigarettes, but other, drugs of abuse. So it's really important for us to keep in mind that the perhaps older way of thinking that, teenagers are going to experiment, teenagers are rebellious. It's really important for us to prevent teens from using these products, especially because they're so high in nicotine.
Yeah. So what can parents do to prevent their child from falling prey to this?
That's a great question. And as a parent of 3 teenagers, I think that it's, the number one thing that we have on our mind. We want our kids to be healthy and to live, healthy lives, which, tobacco use is the exact opposite of that. So first and foremost, when I talk with parents, I say, be a role model. So if you are a tobacco user, we know that it is so hard to quit. Seek resources. There's 1-800-QUIT-NOW, which is a quit line that offers resources and counseling that's available in all 50 states and the District of Columbia, where I am. Go to your regular physician and let them know that you're interested in quitting, because there are very good treatments, both thinking about counseling and thinking about pharmacotherapy, which basically means things like nicotine replacement therapy, like a nicotine gum or patch. And in addition to being a good role model, we also want, you to talk to your kids and set expectations. I know as a parent that oftentimes you think your children are not listening to you, but they are. And so if you let them know that you don't want them to use tobacco, which includes e-cigarettes and vaping, and here are the reasons why, not as a lecture, but this is why you're worried and this is why you care about them, they will listen. So those are, some of the really important things, because prevention really is the most important part of it.
Mm-hmm.
If you think your child is using vape, and some of those, telltale signs may be, that you see some of the e-cigarette paraphernalia. And that's why it is important as a parent and a pediatrician to be able to recognize what these e-cigarettes look like, because they're made to be deceptive. They might look like a flash drive. They may look like a lipstick case. And so it's important to recognize the paraphernalia. You also may notice missing funds. You also, because these products are expensive. And then you also may notice the telltale kind of sweet, either dessert, candy, or fruit smells. In kind of the, when I was growing up, if you smoked a cigarette, somebody could smell that. They would,
as soon as you
smoked a
walked in the
cigarette.
house. Yeah. I mean,
Exactly.
even if you were just around it.
Exactly. E-cigarettes are different because there's thousands of flavors, and, there is tobacco flavor, but most of our youth are not using the tobacco flavor. They're using the green apple. They're using the Sour Patch Kids. Exactly.
Yeah.
So those are ways for parents to kind of clue in that their child might be using e-cigarettes.
So how do you balance, I have a 4-year-old, so I don't yet have a teen, but this is all on my mind. So how do you balance making sure that your kids understand that this has risky long-term impacts with not tempting them? Because when you're a teenager, what your parents say is inherently uncool, and it almost makes it more tempting because it's like, don't press the red button. Don't press the red button. It makes you want to press the red button.
Right.
So how do you balance that with your kids? I mean, from being a parent of teens.
As a parent of 3 teenagers, I totally understand that oftentimes when we give a message, it may not appear as cool. So, what we tell parents, or as pediatricians, what we talk to parents about is really making sure that we craft the message to something they care about. So you're absolutely right. If we talk about lung cancer 30 years down the road, that really doesn't speak to them. But if we talk to them about some of the short-term consequences, which for e-cigarette use, things like the lung damage and lung failure that we've seen, unfortunately, due to vaping, that really strikes a nerve with teens. When we let them know that we, have studies that show that if you vape, you're going to be more likely to cough and wheeze. You're not going to perform as well at school, that the risk is more short-term to them. And that's something that they pay more attention to.
Got it. That makes sense. So focus on the short-term impact that they can actually, they can grasp that. So tell us about your background and what ultimately led you to this work.
Yeah, thank you. I'm a pediatric hospitalist, which means that I'm a pediatrician who really only focuses on inpatient, like when somebody's hospitalized. And early in my career, I noticed that there were a lot of patients, a lot of infants, young children who were hospitalized for breathing problems, like with asthma or with pneumonia, or a disease that we really only see in infants called bronchiolitis that's caused by a virus like RSV and can be caused by COVID. And their parents smoked. And unfortunately, I realized that, the parents smoking was contributing to their child's health. And oftentimes they didn't necessarily realize that. And so that's kind of what started me on the journey to thinking, how can I help these children? And really, oftentimes it was helping the parents quit.
Mm.
And so then the e-cigarette, unfortunately, epidemic came where, there were a lot more teenagers who were using e-cigarettes and then seeing things like Walley, which is e-cigarette or vaping associated lung injury, where, teens were dying. Teens were, having to get a lung transplant because of the effects of it.
Wow. How common is that?
Fortunately, those numbers seem like they have improved. And that was something that we were seeing really kind of right at the beginning of COVID. And unfortunately, with COVID, the FDA and CDC are no longer tracking it at the national level. But it was something reported in every state in the country. And, dozens of people died from the disease. And of course, thousands were hospitalized.
Sure. Wow.
And so I've been really lucky to serve as chair of the American Academy of Pediatrics section on nicotine and tobacco prevention and treatment. And then, I want to work in my local environment here at Children's National Hospital to provide as many resources as possible to both, the pediatric patients as well as the adult caregivers to help them overcome, this medical disease of nicotine addiction.
Yeah. Do children of parents who smoke, are they more likely, less likely, or the same risk factor for starting?
That is such a great question. In terms of cigarette smoking, as you said, they are more likely to smoke. When you think statistically, we don't know yet, of course, because vaping is so new, what those numbers are going to be. So if you have a parent, and especially actually a sibling who smoke, that patient, that child is going to be more likely to smoke.
Mm. Yeah, I was wondering if it would be like, if your parents are smoking, it's uncool. It would have like the opposite effect.
I mean, we definitely hear those stories like my mom smoked, I'm never going to smoke. But when you look at the whole population, and obviously there's a lot of other factors, probably socioeconomic and educational levels, that child is more likely to smoke, unfortunately.
Yeah. So what is your level of optimism that this problem can be corrected by the time my 4-year-old is in high school?
Well, I'm a pediatrician, so I have to be optimistic by nature. I think that a lot of what the e-cigarette epidemic among youth is going to be dependent on the Food and Drug Administration, the FDA, and the regulatory authority they deem over e-cigarettes and vaping. So in 2016, they did pass a deeming rule, which basically gave the FDA regulatory authority over e-cigarettes and vape and other tobacco products like cigars, for example. Unfortunately, they have yet to exert all of their regulatory authority, and groups like the American Academy of Pediatrics and, advocates like Children's National Hospital, we have encouraged the FDA to exert that authority. And so in October of 2021, the FDA did approve 3 different e-cigarette products that were all tobacco flavored. But unfortunately, they have not approved or denied millions of other products. And so if you go to the grocery store or the gas station or go online, there are still products that are being sold that have flavors, that are disposables. And, some of that is the FDA's regulatory authority as well as federal and state enforcement. So we've got a long way to go in terms of protecting our children on the regulation front, as well as marketing and advertising.
Yeah, it sounds like it really needs to be a combination of the healthcare system, policymakers, these companies need to, understand the impact of what they're doing. Is there anyone else that needs, parents probably, maybe even kids need to be involved in solving this problem?
Absolutely. And I think another group that's really important that I've had the real pleasure of working with is our teachers and school administrators, because they're the ones that are finding these products at school. When you have a teenager who's severely nicotine addicted, oftentimes they're using their vape throughout the day. So I've been to high schools where the principal basically brings me a huge box of confiscated e-cigarettes. And they, frankly, they don't know what to do. Certain schools have, taken off the bathroom doors, off bathroom stalls. So that way, kids can't, secretly vape. And what we as pediatricians really want to just make sure that we do is highlight the fact these are kids. These are kids that, really are being marketed to. We know that these tobacco companies are going on social media. They're paying people to be, influencers and say, hey, these e-cigarettes are great. You should use them. And this is a playbook that big tobacco has done, for decades. Yeah. So we want to, really make sure that we're protecting, our youth. Fortunately, Congress did pass Tobacco 21, which means that the sale of tobacco products to anyone less than 21 years of age is not allowed. We do have some opportunity for enforcement, however, with that, in terms of by state and federally.
So how can people get involved and support your work?
So, I think that one of the best ways to do that is to reach out to your local organization. Pretty much every city and county and state has, a tobacco-free task force or tobacco-free group. Certainly, Children's National Hospital and the advocates here are very active at, kind of the district level and then the federal level at saying these are dangerous products for youth. So clearly there's lots of opportunity.
Well, Dr. Walley, thank you so much for the work that you're doing in this space. Thank you for your time today explaining this problem to us. And like you, I am hopeful that we can come together. And by the time I have a teen, this won't be the threat that I'm worried about.
Thank you so much for having me. So we have, it sounds like 9 years until your sweet 4-year-old becomes a teenager.
Yep. That's the goal. Oh, maybe sooner. Hopefully sooner. Let's get it done sooner.
That's right. We'll be working hard. Thank you so much for bringing attention to this.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of OffScrip Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our senior producer is Brianna Seeley. Our intern is Antonella Sterniolo. Our host is Hallie Tecco. It is recorded, mixed, and edited by Brianna Seeley. For advertising and media inquiries, email media@offscrip.com. That's media@offscrip.com. For more information, visit offscrip.com.